tell you something. I was sitting there trying to save everything. I'm like, can you save the nipple? Like, please save the nipple. Like, I'm not gonna have no nipple. I'm not gonna have not one nipple. Like, there's not gonna be no nipple on this side. Like, it's gonna be gone. What's up, guys? Hi. What's up, guys? Welcome to another Journey to 30. Today is a special day. Today is March 3rd. This is an official 2-year anniversary for me for being cancer free. My cancer journey is the reason why I started Journey to 30, because I just wanted to document my life through the stages of cancer. So some of you may know, if you go back in my Journey through 30 vlogs, you'll see my process from the day that I was diagnosed to the day that I had surgery, to the day that I started radiation, to the day that I started chemotherapy, and all the other stuff that came intertwined with that. So to bring you guys up to speed, on February 24th of 2020, I was diagnosed with small cell carcinoma breast cancer to my right breast. And my doctor at the time wanted me to treat it right away because they found it and diagnosed it at a very, very early stage. I have a list of questions that some people ask me frequently that I'm going to say on this vlog, just in case you guys might have some questions. So, how did I find out and what made me go to the doctor? That's the very most frequent question that I always get. So, to truth be told, I've always felt that my breasts weren't shaped or looked a certain type of way normally. Not saying that my breasts were odd looking, it just to me didn't look like it was mature for my age. Right now, I'm about to be 33 years old on March 8th. But at the time, I went through my whole teenage years, my whole early adult years, up until 2020, thinking that my breast shape and size was normal for my age. With that being said, I also had a problem with my menstrual cycle at a young age as well. So I used to get my cycle every couple of months. It wasn't never frequent, like every once a month, like how you're supposed to menstruate. So early on, I thought that I had polycystic ovarian syndrome, which later on I didn't get clinically diagnosed until 2021, that I do have polycystic ovarian syndrome, which I do have a Journey to 30 vlog on that as well. Being that I wasn't technically clinically diagnosed for all those years, I was under the impression that I did have a hormone imbalance, which is true. I do have a hormone imbalance because every time I would get tested or go to the doctor or even see my GYN from my teenage years up until my early adult years, she used to always say, you're producing a lot of testosterone. Your testosterone level is a little bit higher than your estrogen level. So you have to level. We're going to have to put you on hormone therapy in order to level you out, in order to get your menstrual cycle where it should be. Now, I've never gone on a hormone therapy until after my treatment for my breast cancer. So I went untreated for, I want to say, a little over, because I was a late bloomer. So I got my first menses when I was around 15. So yeah, a little bit over 15 years. I didn't really get treated for it. But I did start to regulate around, I want to say 21, 22. I started to see my cycle frequently every month because I was on birth control. But anyway, that's the backstory. So again, what made me go to the doctor and what made me feel that I had to go get checked out is because I felt that my right breast was looking kind of abnormal. By looking abnormal was my nipples started to divert and shift to the left. So well, your nipple is supposed to divert and stay in a forward facing or pointing straight. It's supposed to. But mine started to shift to the left. And I would have these pains, not like real sharp pains, but it would be like a dull pain, like an irritating pain. Or even like sometimes if I wore a certain kind of bra, or if I laid on my chest, it was a little bit painful, but it wasn't enough for me to feel like it was alarming. That I noticed that, like, you know, when you laying in bed and you have your cell phone in your hand or whatever, and sometimes you're tired of holding your phone and you put your phone on your chest, like, I would literally feel like either the current or the radiation on that side. That was one weird thing that I remember going through. Like, why could I feel that? Like, why do I feel either the current, or why do I feel like this, you know, like this staticky pain? I remember talking about that to my doctor, like one of the weird things that I would notice about it. I never had like any leakage, no discharge, none of that coming from my nipple. It was just that it was shifting, and I remember feeling like this little ball right next to it, right next to my nipple, feeling like a little squishy ball. But it didn't get any bigger, it didn't get any smaller, it didn't hurt. It just, at times, it would just be painful. This is what made me go to the doctor. I remember sitting down telling my mother about what I was feeling, and my family, my maternal grandparents, and even my paternal grandmother, they all died of cancer. My grandmother passed away from small cell carcinoma lung cancer, and my grandfather had multiple myeloma. And I forgot what my grandmother on my dad's side, what she had, but she had cancer as well. Also, she had diabetes, high blood pressure, all of that. She had a lot of health issues going on. So I remember telling my mom, and my mother was like, Malika, go get it checked out. Like, you can't play around. Go get it checked out. Also, after I told my mom, the guy that I was talking to at the time, I had told him about what I was feeling too. And he was like, don't play. Like, you gotta go. You don't know what could happen. You don't know what's going on with your body. Just go. So I set up an appointment, and I went to go see my regular primary care physician. My primary care physician told me that he felt around regular. He said he doesn't feel anything. It's nothing to be alarmed about. It could be just a milk dud or swollen milk gland. It could be a lot, but he doesn't think that it's something to worry about. That was the first doctor that I saw. I went to go see another doctor. I'm not gonna hold you. This other doctor that I went to go see, I wanted to slap this lady in her face because she was very rude. So I was telling her about what I was feeling. Like, she even gave me a breast examination. She saw what it is. She just straight up and said, oh, I think that it's nothing that you need to worry about, and you don't have to get checked out. You're too young to get a mammogram. You don't need to see you don't need to get an ultrasound. You're too young. You're too young. You're under 30. You're 30 years old. You don't need it. You don't need it. She was very rude, very nasty. I'm gonna just leave it at that. I went to go set up an appointment with a breast specialist type of doctor who only specializes in women and breast cancer. That was her field. So I set an appointment with her. She did the same thing, breast examination. She asked me how was I feeling, what was I feeling, what were the symptoms. She didn't even say, I don't think it's nothing that you need to worry about. She was like, you know what, just to make sure, I'm going to set up an ultrasound for you. Go to this ultrasound. They're going to do an ultrasound of both breasts to make sure that this little mass is nothing that you need to worry about. So once I went to Adoshi Diagnostic to do the ultrasound, one of the technicians was saying, you know what, we're going to keep you here. We want to do a mammogram. We're going to speak to your doctor and let her order a mammogram for you to take today. We're not going to let you leave. So I took the mammogram. They had me sitting in the waiting room. They had me sitting in the waiting room for a while. And then finally they brought me back into the ultrasound room and did another ultrasound. But this time they were just focusing on my right breast. Now, that's when I felt like there was an inkling or something, because the look on their face and they really wasn't saying anything, but they wasn't trying to let me leave the office. That was over with. They told me to get dressed. They told me the results and the photographs and the disc that they put the images on for the mammogram was going to be directly sent to my doctor. So 2 days go by after that appointment. I get a phone call from my doctor saying, I need you to come into the office right now. We need to have a conversation. I'm not the type of person to panic, but I am a type of person to be in my head about stuff. Like, I will panic inside before I let you see or let people see that I'm physically panicking. So that's really how I take things in. Like, I'll take it inward instead of expressing it outward before anything. And I never forget, it was my mother's birthday, because her birthday is February 24th. It was her birthday. I went to go see her. I told her what was going on. She came with me to the appointment, and I felt so bad because it was her birthday. Getting into the office, my mom, my brother, and my sister are sitting on the other side, and I'm sitting in front of the doctor. And the doctor's like, okay, do you want me to tell you what's going on right now? Is it okay to speak in front of them? Like, do you want them to hear? I'm like, yeah. Say what you need to say. And I'm trying to downplay it so I don't, the blow is not as hard as I think it's going to be. So she finally says, you know what? That little mass that you were worried about, it is a malignant mass. And you know what? We need to treat it right now while it's not threatening. And we're going to schedule you for your emergency surgery in the next couple days. Literally. My surgery was scheduled for March 3rd. Mind you, I found out February 24th. So we're leaving the building, and my mother kept asking me, like, you all right? You okay? Like, tell me your feelings. Speak your feelings. Tell me how you feeling. And I really was at a loss for words because I didn't know what to say. I was just, in my head, I was just like, you know what? Get it out of me. Like, whatever it is, like, get it out of me, because we already know how cancer takes on the body and what toll it brings onto your body. Not only to your body, but your family, people around you. Like, it takes a toll. Like, it's a heavy toll. So initially I was just thinking, like, yo, get this shit out of me, like, ASAP. Like, I don't even want to wait. Like, get it out. I really was more so feeling bad because that's heavy news for my mom, because it's her birthday and then she's finding out that her oldest daughter is going through this. It's like, yo, what how you drop bad news like that on somebody's birthday? That's really how I was thinking, to be honest. But once I figured it out and I stepped back maybe a couple days, I was just thinking, like, this is scary. I was psyching myself out. My anxiety was very high. I was trying my best not to, panic. But once March 3rd came, I had to get up early. I had to get up real early. I think my surgery was scheduled for like 6 o'clock in the morning. I also documented that in a Journey Through 30 about what I had to go through for my surgery. So I had to get up real early. My mom met me at the hospital, and as soon as I went in, everybody was nice. Everybody was cordial. The nurses was nice. The hospital that I went to, they had newly renovated the hospital, so everything was like brand new and crisp and clean. I didn't have to worry about anything. All the nurses, all the staff, everybody was cool. Everybody was laughing and joking. They told my mom that the procedure was going to take probably like an hour, maybe an hour and a half. It's not going to be that long. The only thing that I was confused about was when they told me on the gurney, like, yeah, you're going to have a partial mastectomy, which is really called a lumpectomy. Let me tell you something. I was sitting there trying to save everything. I'm like, can you save the nipple? Like, please save the nipple. Like, I'm not going to have no nipple. I'm not going to have not one nipple. Like, there's not going to be no nipple on this side. Like, it's going to be gone. And the doctor was like, yeah. It looks like the mass is attached itself behind the nipple. So, yeah, we're going to have to take the nipple and the mass. And I'm like, there's no way that you could save the nipple. Like, there's no way that you could save the nipple. And she just kept saying, nope, we can't save it. Gotta go. And I'm like, oh, my God. But once she said we can't save it, you could have nipple reconstruction. And you can have a breast augmentation. It'll be fine. Don't worry. It'll all work itself out later in the long run. I was just more concerned of, I wanted my own nipple. Like, can I keep my nipple? Me saying that, I had the whole surgical room cracking the hell up. But I really was dead ass though. I was dead serious. Like, You can't save the nipple. Like, you can't let me keep my nipple. I don't want no artificial nipple. Like, how that's gonna work? But anyway, went through the surgery, came out. Let me just say this as a disclaimer. When you have surgery and they give you that sleeping medication, that milky sleep medication, yo, that be the best sleep. Let me tell you. That sleep be so freaking immaculate. It's just like you don't want to get up. Like, you're calm, you're relaxed, you're pleasant. It's like the best sleep that you'll ever get. They wheeled me back to my little private room, and my mom was watching TV when I came in, and you know, she was like, "Are you okay? Are you alright?" And this, that, and the third. And the doctor had cracked a couple jokes. The nurses was cracking jokes. We were all keying and laughing and stuff like that. And then the nurse was like, "Well, whenever you're ready, you could get dressed and you could leave." I'm like, it's like, yeah, you can leave. Everything is sewn up. You just gotta come back in a couple of days. But we wanna make sure that the stitches and the sutures and everything is fine. And then they gave me a list of things not to do once I got home. Once I got home now, the guy that I was talking to at the time had met me at my house because he knew I was having a surgery that day. Yeah, met me at my house, and my mom had left because she went to go get some food or whatever, but she was staying. And he was like, he just took over. He was like, "You don't need to be standing up. You need to lay down. Do you need anything? You need to rest." Like, they was really, between the both of them, they was babying me. Not gonna lie, I kind of liked it, but they're really babying me to the point where I was just like, you know what? Let me not do anything because they being mad at me. That was my experience on finding out everything and what I went through, how it went, what made me go to the hospital, what made me go get it checked out, blah, 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 blah. So that was that. So my whole years up until now consisted of, I did 3 months with radiation where I had to go twice a week to go get radiation. That was a horrible experience because when I tell you, radiation doesn't hurt when you're getting it, it hurts after the fact because it changes your skin and it looks so horrible and you peel very bad. Your skin gets very dark, it's very sensitive, it's very itchy. Like, radiation is not fun at all. Because radiation is so freaking painful, they give you like these special lotions to like soothe the area. And let me tell you the side effects of radiation. So the side effects of radiation for me, I did start losing my hair. Like, my hair was falling out. And when I say falling out, I mean like every time I would wash or comb my hair, it would be like big clumps of hair that came out of either the comb or the brush or whatever. Like, my hair really did fall out. I did cut my hair. I cut my hair really, really short. And also I noticed that my skin was like extremely sensitive. Not even just the area where I had to get radiation, but my skin in general was like really, really sensitive. Like, it felt more dry, and it didn't matter how much cocoa butter I use, how much shea butter I use, how much vitamin E oil. It didn't matter. Baby oil, whatever. I was using a whole bunch of oils and butters. It didn't matter how much I used. My skin just felt dry. And it looked kind of, I didn't have like my regular, my regular tone. So to me, it looked like I was sick. Like, it looked like my skin was like on like the grayish kind of side. Like, when you could tell when somebody's sick because their skin gets dark, they have heavy dark circles and stuff like that. Like, I really felt that I was looking sick. So that was my radiation experience. Directly after radiation, I started chemotherapy. So my chemotherapy consists of this. Every day I have to take tamoxifen. Every month I have to take Eligard, which is a chemotherapy injection. With the Eligard, let me tell you how that goes. That shit is painful when they inject that. You're supposed to inject it into the most fatty area, and you have to be a little bit underneath the skin. So it feels like a little bump underneath the skin. That thing burns so bad. It burnt. Imagine somebody taking like a claw knife. Or matter of fact, you know what? Better yet. Have you ever gotten a tattoo? And when you get a tattoo and they shade in that one area and it's like on top of bone, that's what that shit feels like. Like, it's painful. And it lasts for maybe about 15-20 minutes. So I have to take those medications on a daily basis, monthly basis. That's my medical chemotherapy treatment. So my doctor was telling me, my oncologist was telling me that I could be on those medications or chemotherapy for a 2-year period or a 5-year period. Honestly, I want to just be done with it for my 2-year period mark, which is coming up October of 2022. That'll be the mark, my 2-year mark, that I've been on chemotherapy. I'm hoping, not even, you know what, manifestation. I am going to be done with chemotherapy October of 2022. Guys, up to speed. Every year, I have my mammogram ultrasound around the same time. February 24th to March 3rd. Because that's my anniversary. I did that last year and I did that this year. So everything came back clear. Everything is positive, on the up and up. I don't have to worry about nothing. I've been talking to you guys about getting the nipple reconstruction, getting the breast augmentation so that I can look and feel normal again. And that's going to be the upcoming journey that I want to do this year, because I've been medically cleared to go ahead with the reconstruction plastic surgery. So that's going to be on the up and coming journey through 30s that I'm going to try to accomplish before my 2-year mark. What else? Oh, babies, fertility. That's a big thing. Let's talk about that. So, I think it's a money scheme. I honestly think it's a money scheme. I really feel, okay, when you get diagnosed with breast cancer, whatever stage, 1, 2, 3, or 4, and you're of childbearing ages, they tell you that fertility preservation is a must, because they don't know how aggressive you have to go with chemotherapy. They don't know how aggressive you have to be with radiation, and they don't know what type of aggressive surgery that you're going to have. Because of that, they tell you you need to do egg harvesting, follicle harvesting, embryo harvesting, and to keep and make sure that if you do have healthy embryos, healthy sperm, healthy follicles, and they want you to do what they called egg harvesting with the embryos. So they want to take whoever your partner is, get their sperm, inject it into your eggs, and then they'll have a few embryos that are available to you if and when you do stop your cancer journey and want to get pregnant. Because radiation and chemotherapy damages a lot of your body, it's hard for a lot of women to conceive after the fact. So that's why they push fertility preservation. They push all of that, right? Here's where I say it's a friggin' scheme, because if you're diagnosed with breast cancer, ovarian cancer, anything that deals with the reproductive cells or reproductive organs, to me that should be covered under friggin' insurance, and it ain't. I went to about maybe 6 different fertility clinics and told them about my situation, and each time they told me I would have to pay an obscene amount just to do embryos harvesting or egg freezing, or even get my partner to freeze his sperm in order to inject it with my eggs and children when I'm done. So I'm not a mother. I've never had any children. And I'm going to show you a piece of paper that was given to me at a fertility clinic. Now, I don't want to show too much information because some of it is very sensitive. But I'm just going to show you some of these numbers. These people, I'm in the wrong friggin' business because they charge you per egg, per embryo. They charge you per sperm count. And they charge you every month just to hold your babies in a cryo tank. If that ain't some BS, I don't know what is. Because why am I paying you to hold my eggs in your tank or your cryo tank and to ensure that I'm going to have kids later, but then it's running a risk? Because guess what? 95% of the eggs and embryos don't survive during cryo. Let that sink in. 95% of those eggs or embryos do not survive during cryo. The numbers, right? Let's run it down. For monitoring, it's $800 for 1 whole month or $200 per visit. If you want a home kit, it's $850. $300 must be paid out of pocket for the new patients, right? So, egg retrieval, they want $1,250 if 10 eggs are collected. So for every 10 eggs, it's $1,250. $1,250. If anything above 11 through 20 eggs are collected, they want $1,750. If anything of more of 20 eggs are collected, they want $2,000. And you got to pay that out of pocket because it ain't covered through insurance. All right, so boom. Still with me, right? So if you want fertilization for any of your eggs, they want $1,500 for 10 eggs or less. $2,000 for 11 to 20 eggs. And $2,250 for 20 eggs, right? And that's if you want them to fertilize it for you. Then they're talking about for injection, sperm injection, to inject your eggs is free up for 2 eggs only. $700 for 3 to 5 eggs, $1,000 for 6 to 9 eggs, $1,500 for 10 to 19 eggs, and $2,000 for 20 eggs or more. That's how much you gotta pay just for them to inject your man's sperm or whoever's sperm in your eggs. So now, to fertilize your frozen eggs, right? It's $4,500 for 10 eggs or less. $5,000 for 11 to 20 eggs and $5,250 for 20 eggs. Just to freeze these embryos, they want $1,250 for 10 or less. $1,500 for 11 to 20 eggs, $1,750 for 20 eggs or more. The thawing fee, they want $1,500 for 10 eggs or less. So just to thaw your babies out, they want $1,500. They want $1,500 for 11 to 20 eggs and $1,750 for 20 eggs. Ah, now you laugh. Just to thaw your babies out. Just to thaw it out. I'm just going to throw some numbers out here. They have a culture fee. They have a fresh embryo transfer, frozen embryo transfer. They have the luteal phase stimulation, LPS. They have the Palace Rich Plasma and Rejuvenation, PRP. They have ovarian rejuvenation. They have 3D saline infusion sonogram. And they have the ozone sonotherapy. And then you have to pay for local anesthesia, which is free, or light sedation. They want $650. For medical medications, it might vary between anywhere between $85 and $2,000. When I tell you I'm in the wrong friggin' business, I'm in the wrong business. That's why y'all saw me cussing and carrying on about fertility and that journey with PCOS and everything like that was pissing me off, because when they give you these pamphlets and stuff to read when you are diagnosed, you're going to the hospital, they tell you these things are free and it comes with your treatment. And it really isn't, because all of what I just told you, that's out of pocket cost. Your insurance is not going to cover that. It's not going to cover that. You have to pay for that out of pocket. Now imagine you go through all of this and you're like, all right, the light at the end of the tunnel, I'm going to be able to start my family or have a family. And you got to bear down with that. We are already going through a pandemic. People are not getting paid. People are not working. 20, 30, 40K to pay for that. Now, granted, they do have programs set up where you could pay on a month-to-month basis, or you could get a loan to pay for that. But really? Like, that's crazy to me. Like, that whole fertility situation just got me pissed off when I tell you. So yeah, fertility, let me tell you something. If it comes to fertility, try to have your babies. Now, there are certain stipulations where you could take a break from chemotherapy and radiation if you decide that you do want to have children while you're going through treatment. But then who wants to put their child in harm's way, because your body is still have the medication and the radiation in it. So are you sure you want to put your child through that? Do you sure you want to put yourself through that, being pregnant? And then as soon as you have your baby, you have to go immediately back onto treatment. Like, it's like damned if you do, damned if you don't. I think I've answered all the questions. I only had like 5 main questions that was asked. But yeah, breast cancer and the treatments and the therapies and the stuff like that, it is a lot. It sounds like a lot. It is a lot to go through. It's an adjustment. It's a new norm. Alternatives. I mean, you can start going completely alkaline. You can go vegan, because that'll help too, because when you're completely alkaline, you can fight off damn near everything. So you could go pescatarian. There's a lot of things you could do to like ensure that you stay healthy. Yeah, granted that the foods, the fruits, the meats is not good for our bodies. It could be other reasons why you contracted, or other reasons why you develop cancer. It could be hereditary. It could be a lot of factors. So it's not really just pinpointed to one thing. But one thing's for sure, 2 things for certain. Once you are healed, it's in your hands of what you want to do with it. If you want to stay healthy and maintain, or if you just say fuck it, I'm gonna do what I want. I guess I'm gonna end this video because I feel like I'm rambling at this point. But happy anniversary to me. This is year 2. Thank you guys for journeying with me through this traumatic yet devastating yet life-altering, I don't know, thing that happened to me, little old me. But again, like I be telling you most of the times, if you guys know anyone who's going through this, or you know somebody who just got diagnosed and don't know what to do, let them watch this video, and hopefully it helps. Hopefully I'm reaching out to some people. But I see you guys in my next one. Bye.